those who don't know, it is one of the wonderful project which is not far from here, where all the dogmas have been changing, where we are working on a barren land which has been changed into a most fertile land, and I've got a house somewhere over here. Okay, so it's not far. So I've built my second home over here. Although I'm not going to relocate soon, but I will be intermittently coming. So please go and have a look at the YouTube videos about Kanha. You will be blessed to know that you are in a place where this facility is available. Now, about a year ago, I was involved in chairing a session in the Royal College Conference, where there was a discussion about major depressive disorders, and this is our college guidelines, the Australian college guidelines. Generally, whenever we are doing any kind of psychiatry interventions, we go into the step 1, step 2, step 3. I'm not going to details of these things because this is not the relevant. But the step 0 is very relevant. And if you could see here, lifestyle changes, exercise, healthy diet, address substance use. Step 0 doesn't mean 0. Doesn't mean nothing. It is the first step which we have to take. And this is how, and I salute Dr. Narasimha for your interventions into pesticides. This is one of the topics which are quite favorite to me because I come from a state which is Punjab, which is now rampant with both two things. One, high pesticide use, high cancer, and also drug use. And a land which has created so many warriors now is going downhill rapidly. It's very sad scene when I see these things. Now, I'm going to present a case of a lady whom I was involved with. And this has been my early stages, so I'm not very old in this era. It's about 5 to 8, 9 years which I've been doing this for. Right. But this lady, when I first met, she was living with a supportive parent. She had a diagnosis of schizoaffective disorder. She was studying physiotherapy. She had multiple admissions to one of the public mental health facilities called Joondalup. And her symptom profile would usually starts with the classic melancholic features of depression, would go downhill, and then gradually slip into psychosis. There was no definite triggers, there was no substance use, good compliance with the treatment, and as usual, after failed trial, she was put on clozapine, one of the most good drug and also notorious for metabolic syndromes, and put on 30 kilos of weight. Now, when I met her in 2015, there was a poor quality of life, no motivation, exhaustion, field trapped with illness. Now, what do you do when you see these cases? Because you have exhausted all the guidelines, so certainly I always tell them I cannot give you a guarantee, but I want to give you a hope. I will try, if you try, so that we can be in a combined manner, we can address the problem. So first thing is, are psychiatric disorders neuroinflammatory? We have talked about since morning. They have a complex etiology. There are regulatory interplay of large number of genes, and environmental factors are playing a crucial role. And certainly, there can be problems with the challenges with the biome, there can be challenges with the heavy metals, there can be challenges with genetics, but I don't think ever we will have a single gene hypothesis to fix mental health. Now, there have been discussions talking about by Dr. Saxena about certain interleukins. Now, today I'm going to tell you about some of the clinical tips which you can follow in your clinic. So next time when you do a blood panel, look at the monocyte count of your patients. If the monocyte count is high, which is more than 0.5, it is indicated that the immune system is busy. It will just tell you immune system is busy. It will not tell you more than that, which means there has been an exacerbation of IL-1 and IL-6, and when these things happen, the body goes onto an inflammatory cascade. Okay. Now, in this lady's case, this was 0.5, the cutoff was 0.4, and if you could see, when the high normal monocytes are, it leads to inflammation, GIT dysbiosis, activation of HP axis, and also other targeted responses, and as a result of that, you can see a pro-inflammatory set points. So a simple blood parameter marker can be done. Like often when I'm coming down from Australia to some of our countries here, I think a lot of our patients have a shoestring budget. Let's agree on that part. We have to look into the basic panels of testing and how we can make a difference with with some of these things can be very, very important. So please look into that because sometimes we often overlook it. Now, schizophrenia, as we consider that it could be a disorder of, but there are certain dietary immune patterns. And just to let you know that around Second World War, the wheat was a scarcity item. It was shifted towards more to the army and less to the people. And as a result, the study was done in Finland. They found that the incidence of schizophrenia at that time was low because there were less wheat available to the general public. And this was the Dohan hypothesis. And some of these patients can have a distinct reaction which is non-celiac, which is more like an IgG and IgG antibodies. And somehow, if we are able to do some studies or checking that if they have got these AGA positive cohort, can we reverse the diagnosis of these people? And usually, one of my mentors whom I've trained was Dr. William Walsh, who has gone beyond ICD and DSM classification of mental health disorders. And although this will be seen in a very small percentage of patients in schizophrenia, but if your patients are talking about anything related to their gut health or the bloating, please try and ask them to eliminate gluten for a while and see whether they can see a difference. Now, one of my favorite slides. Okay, you can put my name on YouTube, and I have done a podcast on Kahana Cast. We need to cook sleep. Okay, so I like to use a dish analogy in my presentations, and neurotransmitters are nothing but cooking a dish. In order to cook a dish, we need a recipe. Agree? Recipe in a particular order. So, like for example, if we have to cook dopamine, we need L-tyrosine, and this pattern is there. And if we have to cook serotonin, we need this pattern. Now look at how many places different neurotransmitters are required, and also we need some tetrahydrobiopterin, which is an outcome of folate. Now if this folate has to be recycled, and now if there is too much of oxidative stress, we have talked about oxidative stress a lot in previous panels members, then we can see that's a long-term inflammatory cascade which we'll be seeing in this subgroup of people. So whenever I am doing certain testings, I usually look into some of these patterns as part of my initial studies, and as a result of that, when these things are intervened, I've seen that many see a very, very good outcome. Now, this was a study which was published in Schizophrenia Bulletin, and often I share this with my psychiatrist colleague who challenged some of these dogmas or norms, as Digambus has said about that nutrition roles have been there. So as psychiatrists, okay, they don't think that there is any role. And this was a sort of a systemic review which talked about role of vitamin D and folate, and also supplementing them in these cases. Now, today one of our pediatric gastroenterology surgeons talked about Dr. Dale Bredesen. I think you talked. I personally met Dr. Dale Bredesen twice, an amazing fellow, and I think people like him should be present in some of our international forums because he talks about Ayurveda quite a lot. Now, if given a chance to me today, and go back to the medical school, I would like to do a dual degree in both MBBS and Ayurveda. And no disrespect to my other colleagues who have been not doing it, but certainly I feel that this is a very, very important aspect. And the reason why he could reverse dementia, and this is a published article. So any neurologist, please take a photo of this, share with your colleagues. First ask them this question, and then also ask them that read about this. Now, in one of the papers which in our forum, I think I've shared that paper. If not, just ask me, I will share with you. He has given 15 things which we should all be doing to reverse dementia, and some of them are our traditional methods like ashwagandha, curcumin, MCT oil. So Dr. Karuna was today talking about MCT oil today. And majority of you are from South Indian origin, and again I'm repeating this statement, until proven otherwise, coconut oil and its variants, particularly medium chain triglyceride MCT, should be part of your life till last breath. You will never be wrong. Genetics speak the language of your heritage, and that's what Dr. Bredesen has done. And he has successfully reversed. Now, one of the things which we were talking about, as you were saying that we cannot do randomized studies and all. what Dr. Bredesen did was a very amazing thing in the Bredesen protocol. He says that chronic diseases cannot be studied with the RCT model. It has to be n equal to 1. Okay. Now, only thing is that we have to devise certain protocols or mechanism to collect the data and then collate that data, and that's what he did. So possibly the principles of Bredesen protocol can be incorporated into any illnesses, and I personally think that if you do it in first episode psychosis, which is one of the most vulnerable subpopulation, when I come across, we can make a big difference in their quality of life. One of my favorite topic, Dr. Mehdani is not here today, otherwise I would have said that whatever she has said. Now, one of my favorite topic, why I am here today is because of vitamin D. Okay. Because I heard this importance of this. Now, this is, if you look at Dr. Rhonda Patrick and Bruce Emmons, Dr. Bruce Emmons was a Nobel Prize, could have been, should have got it, but Rhonda Patrick is well known for sauna. If you put up YouTube search Rhonda Patrick sauna benefits, you will know about it. Now, they have mentioned about that whenever we have a low levels of vitamin D and low EPA and DHA, we are 5-HT uptake is low. So whenever I'm targeting vitamin D, in Indian setup, it will be 50 nanograms per millimole above, not less. In Australian setup, we say 100 to 125. Sorry, in India it is nanogram, but in Australia it is nanomole. So we have got different ranges, that's why. And combining with about 3 to 6 grams of EPA. So what happens is, vitamin D and omega-3 fatty acids create an environment where you will have a higher uptake of serotonin, which will be glued to the postsynaptic receptor. As a result, you will have a good executive functions, normal sensory gating, and prosocial behavior. So this was one of the landmark study where Dr. Bruce Emmons has proven that vitamin D can have role in mental health. And this is something which I have done, and I did that with the LL's case as well. Folic acid, very, very important. We talked about it quite a lot. This is something which we normally see as a part of the fortification, but unfortunately those people who have got some SNPs, they can have challenges. If you look at the work of Dr. Ben Lynch, who has done a lot of work in this area, there are 64 conditions associated with MTHFR gene mutation. Now, if you have any midline defect, cleft lip, cleft palate, congenital heart disease, hypospadiasis, or umbilical hernia, until proven otherwise, you have a MTHFR SNP. Okay. These people have higher levels of weight gain, 3.6 times on the metabolic syndrome, and also they can have disturbances in the executive function. So which means that nowadays I don't even give folic acid, I always give activated folic acid combining with folinic acid as part of my intervention. Now LL had double heterozygous mutation. What does that mean? That 60 to 70% of folate uptake was a problem. So as a result of that, you will see a classic melancholic features with a lot of negative symptoms. Again, I've already spoken about this. So how do I approach? You can look at my website, integrativepsychiatry.com.au. I have been now preparing some generalized videos about a lot of my patients, including some of the podcasts which I have done, including some of the write-ups which I have been doing, and also I'm doing a lot of whiteboard animations because I like to use, Digambasa, your analogy of explaining things in very, very simple terms. Because otherwise what happens is we can easily bog down into details, but that's what I do. So we have to look at the drivers. Now, the things on the left-hand side are the common ones which can be done. I always say that in Australia they are covered by Medicare, which means you don't have to pay anything for this. But on the right-hand side, they are not covered by Medicare. You have to pay for them. So this is a very comprehensive panel testing. It's not that I do this in every patient, but somehow when I do this, it gives me a lot of answers. Now, what is the core strategy of brain inflammation? Now, brain is a very energy-hungry organ. Okay. Amount of mitochondria given to the brain is much less than heart, kidney, and liver. So, which means that and it's a circuit-based structure. It is not an organ, it's a bunch of wire networks. If the one network area source is problem, the whole series will be affected. So we have to downgrade neuroinflammation, improve brain mitochondrial function because the number is low, antioxidant protection, and neurocytoprotection. So everything has to go simultaneously. And this was the core treatment philosophy of Dr. Bredesen. He said, if you're doing RCT one by one, humanly not possible to have an RCT having more than 40, 30, 40 variables. You can't do it. It's not. It's never going to happen. And that's what he did. But what he did was that he pick up the case, ask them to sign a contract for 18 to 24 months. That family members. Then they have to be, they were thoroughly analyzed based on their history. They were subclassified into type 1, type 2, 1.5, 3, and 4. So he has got about 4 or 5 different types of, and type 3 dementia, Alzheimer's is actually comes by the diabetes. So that's what he talks about it. And then they go through a series of testing, including NeuroQuant. Is NeuroQuant available in here? NeuroQuant, any radiologists? No? It is the volumetric analysis of subcortical structures of the brain. So what happens is that you do a MRI study. It goes to the center's, Dr. Bredesen's lab. From there, you can get a volumetric analysis, which means it's a very precise way of analyzing it, and that's what he did. And as a result of that, he has been training doctors in the Bredesen protocol. I'm sure, I think, Anusha, you would have you done Bredesen protocol as a part of IFM training? No. Okay. Nowadays they are offering it.
Sir, actually I felt Bredesen protocol is a little more advanced than IFM. I've done a Bredesen protocol.
Okay.
I'm in training, but that's even better than IFM.
Yes. But now, because since he has incorporated us along with the IFM, that's what I've heard. So this is a process which I do, digestion, diet, energy, and you all know that, okay? Sure. Now, I cannot cover everything, but I put a lot of emphasis on the digestion and the dietary aspects of the change. Now, if your diet is not going to change, chances are nothing is going to work. Okay? And I always